8 types of miscarriage. Why the diagnosis matter more than you think. Miscarriage is a word people hear and think they understand, but the truth is, it's much more complicated than most of us are ever taught. Two people can both say, I had a miscarriage, and be describing completely different medical situations, different time, different symptoms, different test results, different medical decisions, and different recovery needs. And that's why understanding the type of miscarriage matter. Because when you know that type, you can finally understand what was usually happening in your body, what your doctors are looking for, what follow-up might be appropriate, and what this means, if anything, for the future. Before we go any further, I want to say some things clearly right at the start. Miscarriage is not your fault. It's incredibly common for people to carry guilty, shame, and what did I do wrong question after a loss. But in the vast majority of cases, miscarriage is not caused by some things the pregnant person did or didn't do. It can still be heartbreaking. It can still be traumatic, but blame does not belong here. In this video, we are going to walk through 8 different kinds of miscarriage based on the timing and the clinical description, exactly the way my medical chart and doctors catalogs them. And I will explain not just what each terms mean, but why it matters when you are trying to make sense of what happened. How common miscarriage really is without fear or blame. Miscarriage is much more common than most people realize. Lancet Review estimated that there are about 23 million miscarriages every year worldwide, which works out to around 44 pregnancy losses each minute. This shows that miscarriage is a very common reproductive experience, not a real isolated event, and risk increase with certain factors, especially age. ACOG data suggests that for clinically recognized pregnancy, the risk of early loss is roughly 1 in 5 at ages 35, around 2 in 5 at ages 40, and can approach 4 in 5 at ages 45. Now I'm sharing those numbers for one reason, not to scare you, but to normalize how common this experience is and to reduce the sense of isolation people feel. Because one of the cruelest part of miscarriage is how silent it can be. It happens so often, and yet people often feel like they are the only person it's happening to, but you are not. And when we talk about miscarriage, we have to remember it's not one single event, it's a whole range of severities. Why understanding the diagnosis matter after loss? I make this video because we have seen the same pattern for years, both in research and in real clinic. At GinSen, across our 2 London clinics in Kensington and Chelsea, we support people through fertility journey and reproductive health using Chinese medicine, acupuncture, customized herbal medicine, and evidence-informed care. And some things I have noticed again and again is people go through a pregnancy loss and the emotion pain is already immense. But what makes it even harder is not understanding what the diagnosis actually usually means. What like threatened miscarriage, missed miscarriage, biochemical pregnancy, incomplete miscarriage, then can appear in your notes or be said quickly in an appointment. You are left trying to translate it all while you are still in shock. So my goal here is simply to make the language clear so you can understand what happened, what this means medically, and what support might look like next. And I also wanted to add some things from a Chinese medicine perspective. In TCM, a miscarriage is not seen as one single thing. Like I said, it's an outcome that can happen through different paths, like weakness in knowledge, blood, depression of reserves kidney gene, stress constrained liver qi, or poor recover and indigestion, spring chi. That doesn't mean it's your fault. It means that are different body states that can shape how a pregnancy is supported. You do not need to memorize everything I'm about to share. You just need to recognize which catalog sounds like your experience and what that catalog generally implies. 8 types of miscarriage and how to recognize yours. First, a quick definition. Most institutions agree that miscarriage refers to pregnancy loss before around 20 weeks of gestation. But the type of miscarriage depends on timing and what's happening clinically, what symptoms show up, what ultrasound shows, and what the body is doing in real time. To make this easily to follow, I'm going to group miscarriage into 3 practical catalogs, where the pregnancy is detected mainly by hormones. Loss things on ultrasound, where development stops, but the body may or may not respond immediately. Loss is defined by the miscarriage process itself: bleeding, cervix change, tissues passing, infection, and stress. And then we will talk about recurrent pregnancy loss, which deserves its own section. Type 1, biochemical pregnancy, very early loss. A biochemical pregnancy is when its pregnancy test is positive, but nothing can be seen on ultrasound yet, often before about 5 to 0.55 weeks. The common story sounds like this: your period is late, you take a test positive, then within days, bleeding starts, often like a period, and the pregnancy doesn't progress. Now, I want to be extremely clear: a biochemical pregnancy counts because biologically ovulation happened, fertilization happened, implantation beginning, and HCG was produced enough to be detected. From a TCM lens, this very early loss often overlap with patterns like blood deficiency, not enough nourishment to hold early development, spring chi weakness, poor assimilation and support, on liver constraint from intense stress, the body feeling tired, not receptive, then doesn't mean you caused it. It means if it happens repeatedly, we look at how to strengthen the internal environment before the next attempt. Type 2, early loss seen on ultrasound, clinical miscarriage. A clinical miscarriage is when the pregnancy is confirmed on ultrasound or through tissues confirmation or blood test, and then developer stops. This is often the situation people picture when they think miscarriage because there are usually scans involved. Examples include early signs of pregnancy are seen on ultrasound, but the development is still very early and incomplete. A heartbeat is seen and later is absent. A growth is not matching expected dates. From a TCM perspective, this catalog can overlap with kidney deficiency. The body's long-term reserve are strained. Blood deficiency, nourishment, and circulation are not robust enough. Or blood stasis, circulation becomes obstructed, often showing up with strong cramping or dark clot. Again, this is not about blame. It's about understanding what kind of support your body may need next. Type 3, miscarriage, silent, delayed response. A miscarriage means development has stopped, but the body hasn't started miscarriage process yet. This can be one of the most emotionally disabling experience. No bleeding, no obviously warning sign, and then at a scan, you're learning that the pregnant is not processing or there is no heart beating. In simple terms, the pregnancy has stopped developing, but the body hasn't let go yet. Harmony. From a TCM view, this often maps onto holding pattern where the body is not transmissioning properly. Some things involving like chi stagnation, the body is tense and not moving through paths smoothly of energy, or flame damp accumulation, a heavy stuck internal environment. The key takeaway is that this is a recognized medical scenario and you are not imagining it. Type Therefore, the threatened miscarriage, bleeding but the pregnancy may continue. Threatened miscarriage is one of the most misunderstanding terms. It simply means there is bleeding or spotting in pregnancy, but the pregnancy may still be available, or it may be too early to tell. A common scenario, around 6 to 8 weeks, spotting happen, and an ultrasound shows a fetus and a cardiac actively resembling fine. But because bleeding occurs, the chart may label it threatened miscarriage. This label does not mean miscarriage, while definitely happen from a Chinese medicine land. Early bleeding can often involve spring qi is not holding, the body struggle to contain blood, or heart disturbed the blood, especially if there are thirsty, irritable, or warm sensation, or stress-related liver constraint within the situation. This is exactly where supportive care and monitoring can matter without panic. Type 5. Inevitable, incomplete miscarriage. These terms describe the stages of miscarriage process itself. Inevitable miscarriage. This is when the miscarriage has clearly begun and appears unavoidable, often significant bleeding, and sometimes the cervix is opening. Incomplete miscarriage. This means some tissues remains in the uterus and medical follow-up is often needed. Complete miscarriage. This means the uterus has passed pregnancy tissue. Symptoms usually settle. This means the uterus has passed the pregnancy tissue. Symptoms usually settle. Clinically, may track the HCG down to the confirm resolution. From a TCM perspective, these stages matter because the recovery need can differ depending on whether the body has fully cleared what needs to be cleared. This is completely miscarriage, or is still retained incomplete, which can map onto stasis and lining inflammation patterns. This is also whether post-miscarriage support matter a lot, because even a complete miscarriage can leave the body depleted in blood energy. Type 6 septic miscarriage, infected miscarriage, emergency category. This one is real but serious. It involved infection and require urgent medical care, often include hospital treatment and antibiotic, because infection can spread quickly and become life-threatening if not controlled. Because infection can spread quickly and become life-threatening is not controlled. From a Chinese medicine perspective, this situation is understood as a severe accumulation of toxic heat and stagnation in the uterus and blood stream, while antibiotics are essential for controlling the acute infection. They mainly address the immediate symptoms and the infection agent itself. After the acute phase, its stability, deeper recovery becomes critical. This is where Chinese medicine focuses on clearing residual heat and toxin, supporting the body's ability to resolve inflammation, fully restore healthy circulation, and rebuilding strength after a major physiological shock. Proper recovery is not just about surviving the infection, it's about helping the body return to balance so future healing and fertility are not compromised. Type 7. Late miscarriage, 13 to 20 weeks. Late miscarriage is a loss after first trimester, roughly between 13 to 20 weeks. This matters because later loss can involve different medical decisions and follow-up. At these stages, many people have already seen a heart beating and begun bonding deeply with a pregnancy. The physical process can be more intense and the emotion impact can feel very different. Clinically, providing may look more closely at things like whether the cervix was able to stay closed and supportive as the pregnancy grew, whether the shape or structure of the uterus made it hard to carry the pregnancy longer, whether infection or inflammation may have developed during pregnancy, how well the placenta was formerly delivering blood and nutrition, and in some cases whether clotting or immune response interfered with healthy circulation. From a TCM perspective, when a loss happens later in pregnancy, we often consider patterns such as kidney deficiency, where the body long-term reserves are not strong enough to sustain the pregnancy, blood deficiency, where knowledge and circulation are insufficient for ongoing development, a blood stasis, where circulation becomes obstructed, leading to instability with the uterus. This is why recovery and future planning after a late miscarriage often focused on deeply rebuild kidney reserve, nourished blood over time rather than rushing the body, and carefully regulated qi and circulation to restore a stable internal environment before trying again. Type 8. Recurrent pregnancy loss. Recurrent miscarriage matters because definitions have changed and outdated advice still circulates. Some people are told, don't worry unless you have had 3 miscarriages, but advice is often out of date. Definitions have shifted towards taking 2 or more loss serious and opening the door for early loss to come in valuation. The practical takeaway is simple. If you heard 2 or more losses with biochemical clinic, early, later, or mixed, you deserve an informed conversation about evaluation, support, and what comes next, how to repair yourself. And from the TCM perspective, recurrent loss is exactly where we focus on recovery time, rebuilding blood and kidney reserves, regulating stress pattern and strength digestion and assimilation, because the body baseline state matters. Before we end this video, I want to pause here. If you have been listening and thinking this finally experience what happened to me, then this video has done its job. Understanding the type of miscarriage, your experience, help you move out of confusion and into clear question. But clarity doesn't spot under the label. In the next video, we are going to talk about what usually comes next. What miscarriage is some things doctors investigated further. What kind of tests or evaluations usually make sense, and how to support your body after loss. This first video is about understanding what happened. The next one is about understanding what to do. I'm Dr. Lily here, represent GinSen London. I will see you next time. Thank you.